Hello. It was about 2,000 years ago that the ancients recognized that there were some people, not everybody, but some people had sweet urine. They recognized this because if the urine spilled on the ground, the ants were attracted to it. They called the disease diabetes mellitus. Diabetes because that's the Greek word for fountain, and mellitus because that's the Latin word for sweet or honey. So it's honey fountain, or we call it diabetes mellitus or sugar disease. So if you would like to learn something about this sugar disease, we'll be talking about this during this program, and we hope you'll join us.
The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented. Welcome to Help Yourself to Health with Dr. Agatha Thrash of Uchee Pines Institute. And now, here's your host, Dr. Thrash.
Now, diabetes is actually two separate diseases. One we call type 1 diabetes, and the other we call type 2 diabetes. Those we used to call them juvenile diabetes and adult onset diabetes. Now, we don't actually refer to them anymore by those terms because we recognize now that some adults can get what we used to call juvenile diabetes. And now with overweight being so prevalent among children, we are now seeing the type 2 diabetes very frequently in small children. And so we now refer to them as type 1 and type 2. But they are two separate diseases and have totally different ways that they express themselves in the blood tests. Now, in order for us to fully understand about this, we, of course, would like to know something about how the blood sugar is handled in the body and just what we can do to make the body better able to handle sugar. When sugar builds up in the bloodstream, that causes an irritative problem to blood vessels. Sugar itself is what we might call an irritant in the blood. And insulin, while it's essential to life, as sugar is also, while insulin is essential to life, we cannot function without it. If we get too much, then we can look at it in lay terms as an irritant. And it causes a number of problems for the body, one of which is overweight. That's one reason for that is that it's a very good appetite stimulant. So as it goes higher in the bloodstream, the person has more and more appetite. So if they see something they like and they don't have habits that are very strict and make it so that they will not eat at certain times and will not eat certain things that they know to be unhealthful, if they don't have those habits well ingrained, then because of the surge of appetite that comes with the high insulin levels, they tend to overeat and to eat too frequently, and to be willing to eat foods that are very sweet. They tend to have a very good appetite for foods that are very sugary or very salty or very fatty. And all of those tend to promote more appetite and also tend to promote overweight. So there are some ways that we can help ourselves by dietary restrictions. But if we know some of the complications that can occur from diabetes, that too is a deterrent or an inspiration or a motivating factor to help us to learn about these diseases and to get so that we are not ravaged by the diseases and the complications.